Have you ever thought about what high blood pressure could be doing to your body right now? High blood pressure, a term we've all heard, but how many of us truly understand what it means? It lurks in the shadows, silent yet deadly. It's often referred to as the silent killer, and for good reason. This condition is not just a number on a chart or a reading on a machine, it's a relentless force that can wreak havoc on your body, often without any visible signs or symptoms. So, what is high blood pressure? Picture this: your arteries are like pipelines transporting blood from your heart to the rest of your body. When you have high blood pressure, it means the force of blood against your artery walls is consistently too high. It's like water being pushed through a hose at full force, all the time. It can damage the walls of your arteries, and over time, this can lead to serious health problems. Now, why is high blood pressure often undiagnosed? The answer is simple. Most people with high blood pressure feel perfectly fine. They don't have any symptoms. No headaches, no dizziness, no shortness of breath. Nothing. But that doesn't mean it's not there. It's silently damaging the arteries, the heart, the kidneys, and even the brain. But what causes high blood pressure? There are several possible culprits. It could be due to age, as the risk of high blood pressure increases as you get older. It could be related to family history, as it tends to run in families. It could be due to lifestyle factors like a diet high in salt, lack of physical activity, being overweight, or consuming too much alcohol. It could also be related to certain medical conditions like kidney disease or diabetes. So we've established that high blood pressure is a silent but significant threat, one that could be lurking within us as we speak. It's an invisible enemy, one that doesn't discriminate, doesn't show mercy, and doesn't play fair. Now, let's dive deeper into why high blood pressure can be so dangerous. Scene script. High blood pressure, while silent, can cause havoc to your body. But what makes it so dangerous? Let's delve into the heart of the matter. High blood pressure, or hypertension, is a condition where the force of blood against your artery walls is consistently too high. Over time, this excessive pressure can damage your blood vessels, leading to a host of serious health problems. One of the most common and lethal complications is heart disease. The high pressure can cause the coronary arteries to narrow, limiting the supply of oxygen-rich blood to your heart. This can lead to angina, a type of chest pain, or more seriously, a heart attack. In the United States alone, heart disease is the leading cause of death, claiming over 600,000 lives each year. Another significant risk is stroke. High blood pressure can cause blood clots to form in the arteries leading to your brain, blocking blood flow and potentially causing a stroke. Strokes are the fifth leading cause of death in the United States, and the high number of stroke cases is a testament to the dangers of uncontrolled hypertension. Then, there's kidney disease. Your kidneys filter excess fluid and waste from your blood, a process that depends on healthy blood vessels. High blood pressure can damage both the blood vessels in and leading to your kidneys, resulting in their failure. Lastly, let's not forget about vision loss. Hypertension can strain the blood vessels in your eyes, leading to conditions like retinopathy, choroidopathy, and optic neuropathy. All of these can result in impaired vision or even blindness. These are just some of the many health risks associated with high blood pressure. The facts and figures are alarming, reminding us of the silent yet destructive nature of this condition. While these complications sound scary, understanding the risk factors can help prevent them. What are the risk factors of high blood pressure? Could you be at risk? Let's delve into the main risk factors of high blood pressure, a condition that can sneak up on anyone, regardless of age, race, or lifestyle. However, some factors can significantly increase the likelihood of developing this silent killer. Firstly, age plays a crucial role. As we age, the risk of high blood pressure increases due to natural changes in our bodies. For men, the risk starts to climb from 45 years of age, while for women, it's typically from 55 years onwards. Race is another factor. Studies have shown that people of African descent are more likely to develop high blood pressure earlier in life, and more severely compared to other ethnic groups. Family history also matters. If your parents or close blood relatives have high blood pressure, you're more likely to develop it as well. Obesity is a significant contributor. The more you weigh, the more blood your body needs to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. Physical inactivity leads to higher heart rates, causing your heart to work harder with each contraction, and increasing the force on your arteries. A lack of physical activity also increases the risk of being overweight. Tobacco use, including smoking or chewing tobacco, can damage your artery walls, narrowing them and increasing your blood pressure. Dietary choices matter too. A high sodium diet can cause your body to retain fluid, leading to high blood pressure. At the same time, a low potassium diet can unbalance the volume of sodium in your cells, also leading to high blood pressure. Lastly, alcohol abuse. Over time, heavy drinking can damage your heart. Having more than 1 drink a day for women and more than 2 drinks a day for men can raise blood pressure levels. Now that we know the risk factors, let's explore how we can manage and control high blood pressure. High blood pressure may sound like a life sentence, but with proper management, it can be controlled. Let's delve into some of the ways you can keep your blood pressure in check. First up, lifestyle changes. These are often the first line of defense against high blood pressure and can be surprisingly effective. A healthy diet is paramount. Aim to include lots of fruits, vegetables, whole grains, and lean proteins in your meals, while reducing your intake of sodium and processed foods. Essentially, if it comes in a box or a can, it's probably not your best option. Regular exercise is another key aspect of managing high blood pressure. It does not mean you need to become a marathon runner overnight. Even light activities like walking, cycling, or yoga can make a significant difference. The goal is to get your heart rate up in a safe and controlled way, so find an activity you enjoy and make it a part of your routine. Stress management is another crucial component. High levels of stress can temporarily raise your blood pressure, and habitual stress can lead to long-term hypertension. So, it's important to find effective ways to relax and de-stress. This could be anything from reading a book, meditating, or even gardening. The key is to find what works for you and make it a part of your daily life. Of course, lifestyle changes may not always be enough, and that's where medication comes in. There are numerous medications available that can help lower blood pressure. Your doctor can guide you in finding the right one for your specific circumstances. It's important to take any prescribed medication exactly as directed, and to communicate regularly with your doctor about any side effects or concerns. In conclusion, managing high blood pressure involves a combination of healthy lifestyle choices and possibly medication. It's about making long-term changes for the sake of your health. Remember, it's never too late to take control of your health. So, we've learned about the dangers of high blood pressure and how to manage it. But what's the key takeaway from all of this? Well, let's revisit the main points that we've touched on in this video. High blood pressure, often referred to as the silent killer, is a condition that can lead to severe health complications if left unchecked. It's a significant risk factor for heart disease and stroke, 2 of the leading causes of death worldwide. We've also discussed the various risk factors associated with high blood pressure. These include a sedentary lifestyle, unhealthy diet, excessive alcohol intake, and tobacco use, among others. Genetics and age also play a significant role. However, by being aware of these factors, we can take proactive steps to mitigate their impact on our health. Perhaps most importantly, we've explored how to manage high blood pressure. Regular checkups are crucial in this regard. It's essential to know your numbers, as this will allow you to track your progress and make necessary adjustments to your lifestyle. Moreover, maintaining a healthy lifestyle is key to managing high blood pressure. This includes regular physical activity, a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, and limited intake of sodium and alcohol. And let's not forget about the importance of managing stress, which can significantly contribute to high blood pressure. It's clear that managing high blood pressure requires a multifaceted approach. It's not just about taking medication, although that can be a part of the solution for some. It's about making comprehensive lifestyle changes and staying committed to your health. High blood pressure can be a silent killer, but with knowledge and action, you can take control of your health. Remember, your health is in your hands. Your journey towards better health begins with awareness and understanding, and it continues with the choices you make every day. So, let's take control, one step at a time. If you find this video helpful, please share with your family and friends. Please like and subscribe for more health awareness videos.